Here at Center for Advanced Vein Care, we take care of patients that have issues related to their veins or lymphatic disease. Some places specialize in spider vein treatments or treatment for the cosmetic concern of their legs. What we like to concentrate on here is keeping people healthy, keeping people moving and walking, because a lot of times vein disease can interfere with your overall health by making you feel uncomfortable with doing normal everyday activities, such as hanging out with your kids on the beach for the day or going to Cedar Park or to the zoo with your grandchildren. So our primary concern here is how can vein disease be treated to help you do your normal activities and live a happier, healthier life.
How do you treat vein problems here?
The first thing that happens when someone comes in for an evaluation for their vein health is we look to see, first of all, if there is some vein disease. The first step is we get what's called a quick scan. And it is literally a quick scan of some of the major veins in their legs. And on that scan, we will be able to tell if there are larger veins causing problems, or if maybe your issues are more on the surface, those spider veins people talk about. Once that's determined, we will typically get a more complete scan, and that scan will show us where the problem starts, as well as what the veins look like on the inside. From that scan, we can determine what type of treatment is going to be best for your legs. The good news is the treatment for vein disease has changed dramatically in the last 20 years. It used to be that if you had bad vein disease, you had vein stripping surgery. And I've still yet had to hear from one person that vein stripping was a pleasant experience. Most people come in telling me they've avoided having vein treatment because they remember their grandmother or their mom or dad or even a friend that might have had vein stripping in the past and how horrible a procedure it was and how difficult the recovery time was.
What causes the vein disorders?
About 95% of the time, your vein disease is hereditary. A lot of people think about vein disease being related to weight issues or an injury that they might have had, and all of those things may play a role, but vein disease happens for many other reasons, including aging, jobs and activities where we sit and stand for a long period of time, and all of these different stressors combine to eventually make your veins not work as efficiently or effectively as they're supposed to. And as that happens, you start getting symptoms related to the veins not functioning properly.
When I think of compression, I think of the old lady stockings that we knew of when we were growing up.
Absolutely. You know, we used to think of compression as being told that now you're going to look like you have peg legs for the rest of your life, if you've ever heard that term. Or sometimes we think of compression as being the granny stockings. The reality is there are so many types of compression out there that are kind of catering to all of the activities we want to be doing in life. So I'm wearing compression today that most people would never think was compression. Compression now comes in different colors. It can be sheer. It can be something as simple as a red tie-dye compression. There's so many styles to choose from.